question is most people are anxious to find out whether or not the Western Cape has passed its peak, but my concern is that we shouldn't be complacent. Irrespective of whether or not we've reached our peak, we suspect that this disease is going to be with us for months still to come. And the issues of resurgence or sort of a second wave, we need to be considerate of these things. So if you're asking me with regards to whether or not we have passed our peak so that you can breathe a little bit more, my suggestion is still practice social distancing. Still be wary of the fact that you could contract COVID or potentially infect someone else with COVID. By the looks of it, we've had a decrease in the amount of patients requiring hospital admission. But if you compare it to the amount of deaths we're having, I don't think we should be complacent in any way, thinking that we've passed a peak.
We had quite a tremendous peak initially, and just about every patient that walked through our casualty was actually COVID positive. Most of them were in marked respiratory distress requiring intensive care. But since then, things have settled down and our numbers have certainly fallen. So I really think we are past our peak, but that is for the first wave. Many countries have actually had a second wave, and the second wave will probably come even when the lockdown laws have actually been settled down. That's when we will probably see a second wave coming through. So I'm expecting that we will have a second wave at some point. No, we cannot let our guard down. We still have patients coming through, and I'm seeing a lot of colleagues and fellow staff members also coming through towards the latter part of this first wave.